presentation includes information regarding the voice disorder keratosis or leukoplakia. Keratosis is a disorder in which lesions form on the epithelial surface of the vocal folds, causing abnormal tissue growth. This originates in the epithelium, but may enter the superficial layer of the lamina propria of the vocal folds. Keratosis may also be referred to as leukoplakia, hyperkeratosis, dyskeratosis, or keratosis with cellular atypia. Keratosis is a histological term used to indicate a pathological condition and accumulation of keratin on the epithelial surface. The lesion seen would be irregular growth of epithelium resulting in warty lesions, whereas leukoplakia is a clinical term used to describe the white patches seen on the laryngeal mucus. The lesions seen are flat, white, plaque-like spots. Smoking, environmental pollutants, and gastroesophageal reflux have all been recognized as factors that cause these sort of lesions to form. This tends to happen more in men versus women. These lesions may occur only on one side of the vocal folds or on both sides, but are generally asymmetric in size and location. The picture on the left here shows a unilateral lesion, whereas the picture on the right here shows a bilateral one. This picture is not very accurate though, as it shows the lesions being symmetric. Perceptually, you would expect to hear either roughness or hoarseness, possibly both, and this can range in severity from very minimal to complete voice loss. There has not been much research done on the acoustic or aerodynamic characteristics of patients with keratosis, but due to the growth on the folds, we would expect to see a higher frequency, amplitude perturbation, and greater airflow. During stroboscopy, there would be visible white, plaque-like lesions, which may be limited to one spot or could cover the whole vocal fold. Papillary keratosis could also be seen, which would look like a small reddish epithelium or irregular mucosal covered in keratin. Due to the varied appearances common in keratosis, stroboscopic visuals can show a variety of abnormalities in the vocal folds, such as rough vocal fold edges, irregular shaped glottal chink, aperiodicity, or limited mucosal width. Here is a stroboscopy video of a patient with leukoplakia. Here you can see the white plaque-like lesions on the outsides of the vocal folds. Keratotic lesions affect the cover layers of the vocal folds, which increase the mass and stiffness. Below are pictures of lesions compared to normal vocal folds. So here's a unilateral lesion on the vocal fold, as well as this one. This is a visual of what the vocal folds look like when they are closed with a lesion. And this is a normal vocal fold closed. As you can see, these can close completely, whereas the ones up here with the lesions are not able to. Thank you.